Hi, this is the second part of the cardiomyopathies, and here we are starting off with the hypertrophic cardiomyopathy. The introduction to hypertrophic cardiomyopathy we have covered in our previous video, part 1, and here we gonna see the specific things about this condition. First of all, what is the problem? Here, the problem is the mutation of the myosin binding protein C or beta myosin heavy chain. If these two options are there, you have to mark the beta myosin heavy chain. This is the more important one. So beta myosin, we know that myosin is a heavy chain, right? So there is mutation of the beta myosin. That's it. Okay. The second thing is how the patient gonna present to you. You can see so much of the muscular mass. Which person have that muscular kind of thing? It is, an athlete, an athletic person. Okay. So the question will be framed as like an athlete was doing his routine exercise or something and he collapsed suddenly. So the syncope during the exercise may lead to sudden death, for example, in young athletes due to the ventricular arrhythmia. So what is the cause of death? Mostly it is ventricular arrhythmia. And also now the findings are there will be signs of heart failure like S4 and systolic murmur, etc. And the second thing you need to remember is the cardiomyopathies generally show the regurgitations because it leads to the impaired mitral valve closure. Okay, so the second thing is it is so much of hypertrophy and so much of muscle and so much of power that they can lead to the regurgitation through the mitral valve. You can remember it in this way. Okay, now we have done that it is diastolic dysfunction because there is increased power. It cannot actually dilate properly, it cannot relax itself, so it is a dilated dysfunction, diastolic dysfunction. And the hypertrophy is concentric. I have told you that concentric means that whenever the hypertrophy grows within the ventricle, when the hypertrophy is away from the ventricle, it is the eccentric hypertrophy, and when the muscle mass grow inside the ventricle, it is a concentric hypertrophy. Okay, the second thing I have told you, the septum is involved and it is asymmetrical hypertrophy. The septum here you can see it is involved. Okay, now this thing you need to remember is the banana shaped ventricle. Let me show you image of this banana shaped ventricle. Here you can see the banana shaped ventricle. Why? Because the volume of the ventricle, the size of the ventricle has been reduced. It is lesser now. So that leads to banana shaped ventricles. And on histopathology you can have the myocyte disarray or the helter skelter appearance you can see. Now, yeah, we have the treatment. In treatment we have to actually reduce the efforts by the heart that it is putting due to so much of muscle mass. So we will give the beta blockers and the calcium channel blockers. Okay, now let's go to the third and the last thing, that is the restrictive or the infiltrative cardiomyopathy. It is very easy. The thing we have to remember is it is kind of a plastic bag. Plastic bag cannot dilate properly, so it is a diastolic dysfunction. Okay, so it is a low voltage ECGs. Obviously it is not no more elastic heart, so the ECG will be low voltage. That means the spikes will be very very smaller as compared to the normal ECG. And here we what are the reasons for this restrictive or infiltrative cardiomyopathy? It is any radiation. After the radiation you can have the restrictive cardiomyopathy. Then we have the Lawful's endocarditis, that is important. Okay, We have the fibroelastosis or amyloidosis. Amyloidosis is very important. Then hemochromatosis. See, hemochromatosis is also a reason for dilated cardiomyopathy. It is also a reason for restrictive cardiomyopathy. See, what is endocardial fibroelastosis? It basically occurs in 2 years of life, may be associated with mumps. So, in question, you will have a patient with the history of mumps. Now, the last thing is Lawful Endocarditis, and here you need to know there will be eosinophilic syndrome, eosinophilic syndrome along with the restrictive cardiomyopathy. That's it. So the thing you need to remember mainly is the dilated and the restrictive. Dilated, you need to remember the titin gene. The titin gene, it is the most common cardiomyopathy. It has a ninja star and the boxcar nuclei. If the hypertrophied fibers are there, then we have the Takotsubo cardiomyopathy. The second thing is the hypertrophic cardiomyopathy, in which we have the banana shaped ventricle and myocyte disarray, and the protein involved is the beta myosin heavy chain. Okay, and it is a diastolic dysfunction. And the last thing is, what is Lawful's endocarditis? Lawful's endocarditis is the hypereosinophilic syndrome. That's it. It is a small topic, and this is basically the introduction and the concept of the thing that we need to know.